Women's heart health is something that I'm incredibly passionate about because we have an awareness problem, both from the consumer and we have an awareness problem from the provider. Do you know that 1 in 31 women die of breast cancer, which is terrible, but 1 in 3 women die of heart disease? Do you know that 64% of women who have a heart attack had no idea that they even had a problem? Do you know that the awareness that heart disease was our biggest threat in 2009 was much higher than it was in 2019? And the people that have decreased their awareness are the most vulnerable. And so we have a lot of work to do with awareness, number one. But the other issue is recognizing women's heart health from the provider standpoint. Women tend to present later in the ER, and women's symptoms are so different. You know, women don't present with the classic chest pain, left arm pain, jaw pain that we often hear about. Some do, but the majority of women have symptoms that are unique, like, I have anxiety, I'm just not feeling right, something is going on with me. Oh, my stomach's upset. I'm sweating profusely, I don't know what's wrong. This feeling of dread, I can't sleep. Those are the top symptoms that women experience. And so if a woman goes into the ER with vague symptoms like that, she's not often put into a hat of this might be a heart attack. Same goes for women going into a traditional medical office. Those symptoms are often downgraded to be anxiety or life or menopause or hormones. And so I always tell women this: if you feel different than you've ever felt before, consider the plausible reality that it could be your heart. And a lot of women say, I don't want to go in because I don't want to be told it's okay, and then I wasted everybody's time. I don't know why we as women feel that. The best thing we could do is go in and get checked out and told you are okay. That's the best thing that could happen. A women's health span provides these wonderful opportunities for identifying risk throughout our lifespan. For example, when a woman is pregnant, there's this wonderful opportunity to identify preeclampsia that increases our risk dramatically within a short time after birth, and even 10 years after the child is born, that the risk goes up about twofold of having a blood clot that could land in the leg, the lungs, the heart, or the brain. Things during pregnancy like gestational diabetes. When the pregnancy's over, oftentimes the diabetes is going to go away. But it's not a matter of if that woman is going to become diabetic in her lifetime. It's really a matter of when. So that woman being nurtured in an environment where she gets glucose tolerance tests regularly, that she understands the need to keep her inflammation down. Pregnancy is just a wonderful opportunity to identify that. And then as we get older, we realize things like migraine headaches for women with aura increase their risk of late brain infarct or a stroke in the brain by 90%. So we have all these opportunities to identify risk through our life. And then even as we go into perimenopause and menopause, where our whole hormone cycle is changing, that's an opportunity to see, as we lose our own endogenous hormones like estrogen, our cholesterol is going to just continue to rise, and our good cholesterol, or HDL, is going to continue to fall. So we present with these opportunities to identify trends, and if we aren't followed regularly, we may not know those trends. So I'm a huge advocate for women being identified as such tremendous, vulnerable individuals for heart disease, and it doesn't have to be that way. All adults balance a lot. Women balance a lot, whether they're in a professional setting and then they're also raising children and really taking care of the household. Men do the same thing. That is all true, but women carry a lot of responsibility on their shoulders to make sure everybody is okay. And so oftentimes women are the last ones to say, I need to be checked out. I'm not okay. What I often hear women say is, well, I wanted to bring my husband in because he has risk. He's got a family history. And sometimes I say, well, what about you? Do you have a family history? Well, yeah, but we need to see him. I said, we need to see both of you because you're both important. So that's something that is so critical, that women just realize that they're worth it and they need to get checked out so that they never have a problem moving forward. The other thing that has been recently published is women who are in a situation of domestic violence have a 44% increased risk of having a heart attack. And the reason I'm mentioning that is because dentistry might have the opportunity to identify that woman in crisis in a very subtle way. And I think I just want to bring that awareness that women that deal with post-traumatic stress disorder are very vulnerable, and women who are in an abusive relationship have an increased vulnerability to heart disease, and they may not know it.